the Health Professions Council of South Africa is concerned with the number of fake doctors in this country, saying this is putting patients' lives in danger. Some of these false healthcare practitioners claim that they're registered with the HPCSA, when in fact they're not. To speak to us about how the public can tell when a doctor is legit, let's bring in the Council's Head of Corporate Affairs Division. That's Christopher Tsatsawane, who joins us via our telephone line today. Christopher, it's great to have you on. Thanks very much indeed for speaking to us. And we're having this discussion on the back of a really troubling development in Kimberley, where a 38-year-old man has now been arrested because he posed as a healthcare doctor, drawing a teenager into what looks like a surgery room, and sadly went on to rape this teenager. How widespread is this problem of fake doctors in the country?
Good morning, Ayanda, and good morning to your viewers at home. There is a growing trend which is a concern to us as the Health Professions Council of South Africa, because we have picked up a pocket of persons who are masquerading as registered doctors when in actual fact they are not qualified or not even registered with the council in terms of the Health Professions Act 56 of 1974. So this is a trend which we have realized that it is growing, and it is a cause for concern because it puts the health of the public at risk.
Yeah. And what exactly are these doctors typically doing? I mean, are they practicing medicine? In other words, are they writing out prescriptions and actually giving out medical examinations?
Some of the culprits that we have been able to pick up are people who are actually operating as a fully fledged doctors who also prescribe medication.
Wow.
And this is the reason why, as the HPCSA, we would like to make a special appeal to members of the public to make sure that they establish if the practitioner that they are consulting with is really qualified, and most importantly, they need to also establish if that practitioner is also registered with the council in terms of the Act, because the Act, in terms of Section 17.1, indicates that there is no person who shall be entitled to practice within the country unless they are registered in terms of the Act. And it also goes on to say it is also illegal and a criminal offense to practice without having registered with the HPCSA.
Of course, it's tantamount to fraud. But I mean, the sad reality is that by the time someone who is ill is in a doctor's room, they already feel very vulnerable, if not distracted by other things. What are some of the key questions you reckon patients should be asking in the event that they're even suspicious that the doctor they're seeing may not be practicing legitimately?
Thank you very much, Ayanda, for that question. And I think that the truth of the matter is that on face value, it might not be very easy for patients or members of the public to establish if the practitioner they are making use of is qualified or experienced or registered with the Health Professions Act, because some of these culprits or perpetrators are very, very sophisticated in terms of their operations. They make use of fake qualifications. Some of them make use of fake names and so on and so on. But to answer your question, Ayanda, members of the public or patients, just to be safe, they actually have a right or responsibility to ask for a registration number or registration certificate, which they can verify with the Health Professions Council of South Africa. This is a right or responsibility which patients or members of the public have, so that they can really be comforted or verify if indeed the practitioner they are making use of is registered with council. There are quite a number of ways that this can be done. One of them is through our email address or our website, which is www.hpcsa.co.za. They will get an iRegister on our landing page, through which they can just punch in the registration number. Then they will be able to see the status of the practitioner that they are making use of. And besides that, members of the public can also get in touch with us through our inspectorate office, through the email address, which is inspectorateoffice@hpcsa.co.za. Our inspectorate office, once they have been informed of any suspicious behavior, they will work very closely with law enforcement agencies to make sure that culprits or perpetrators are brought to book.
Sure. Important information. On the website option, how quick is it, the verification process? Because I'm thinking of myself in that consultation room, trying to ease my own suspicions. And secondly, is there a kind of photo that accompanies a result that shows that the number itself is legitimate? Because I may very well use another doctor's registration number, whereas I myself am not practicing legitimately.
Yeah, like I said, some of these culprits or perpetrators are very sophisticated in the way they operate. But to respond to your question, to verify registration through our website is very quick. Within 2 minutes, once you have the registration number and you punch it in, the system will be able to inform you or give you the reflection or indication of whether that person is registered or not. And if you are still not certain by any chance, because as you rightfully indicated, some of these practitioners might be using names and registration numbers of people who are really registered. So you can also get in touch of our call center so that our own officials can be able to do the necessary verification internally, and within a day or within a space which is very short, we will be able to come back to you with a clear indication of whether that practitioner is registered or not. All
right. Last take. I mean, what happens in the event that I find out that the person I've been seeing for quite some time isn't in fact legitimate, and I'm worried that, I may be adversely affected by something like a wrong prescription, wrong diagnosis, etc. What recourse do victims of such crimes have?
Yeah. Once there is a clear verification or identification of the fact that the practitioner that was being made use of is not registered, is not qualified, we make use of law enforcement agencies to bring this issue to the police, because now it becomes a criminal matter. As I indicated earlier, in terms of our act, practicing illegally is criminal, and once that has been verified and confirmed, we need to work very closely with the police so that the culprit can be brought to book. So the recourse is that a criminal case will be opened against the perpetrator, and then from there the law will take its course.
Christopher Tsatsawane, thanks very much indeed for speaking to us. All of those very important details. And just so you know, we'll make sure that we upload this interview on our social media pages speedily this morning so that you can catch those details once again. Christopher is the head of corporate affairs at the HPCSA. That's the Health Professions Council of South Africa. Thanks very much once again.